Great Day Houston. And now, your host, Deborah Duncan.
Extreme fatigue, depression, and forgetfulness, you don't have to live with the symptoms associated with getting older. Here to show us how to turn back the clock on how you feel, please welcome Dr. Stephen Hotze with Hotze Health and Wellness Center, along with his patient, Johnny Lee.
Thank you.
All right, the first thing I got to do is, okay, let's look at Johnny's body. Okay, I hate to do this to you on TV, but look at this body here. Long, lean woman, right? But before the break, I mentioned how you had gained 35 to 40 pounds in just 1 month, or less than a month.
Yes, I did. After my 43rd birthday, I gained between 35 and 40 pounds. I was like, this is not normal, and my friends were going, oh, it's middle age, not a problem. And
yeah, you just got to live with it. And Dr. Hotze, anybody who gains that kind of weight, I would imagine the first thing the doctor says is, how many pints of ice cream are you doing a day? Because that's an excessive amount of weight.
The thought does cross people's mind.
But a lot of patients will come in and say, okay, so here it is. I'm tired. I'm forgetful. I've gained a lot of weight. And I'm either asked to take antidepressants and go on a diet or whatever, but nothing's working. You hear this story 100 times a day.
As a matter of fact, talking about antidepressants, one of the side effects of antidepressants is more weight gain. So you're depressed because you're gaining weight. When you take that, you get worse.
Yeah.
But anyway, Johnny, this happened right after your 43rd birthday, which is not uncommon for women in midlife. Once they hit their 40s, the hormones begin to fluctuate and change. So the female hormones become imbalanced, and that adversely affects their ability to properly use a very important hormone derived from a gland in your neck called the thyroid gland. The thyroid gland in your neck produces thyroid hormones, which govern your body's metabolic rate, your energy level.
Yeah.
And so as your thyroid hormone level declines, or you're not able to get it into the cells, assimilate it well enough, and this happens 6 times as commonly to women as it does to men because of the hormonal changes that occur as they approach the change of life, then they begin to have all the symptoms of low thyroid, which you did.
I did.
And so you went and saw your physician, and what happened?
Well,
what did he say?
He's like, well, we'll do blood work. And so they ran the typical thyroid test, just check.
Let me guess, you're within the range?
Yes and no. My physician at the time sent me an email saying, oh, you're borderline thyroid, your progesterone's really low. Take some progesterone cream, call me in a month, and we'll reevaluate it. And I'm looking at the results, and I'm going, are you kidding me? This cannot be right.
Yeah. Did you have any idea that thyroid might be?
No, I really didn't. I just knew that I didn't feel right. I'm very active and just energetic, and I was tired and foggy and just...
And Dr. Hotze, that's why a lot of us go for the second, third, fourth, fifth opinion, is because we're like, you're medicating my symptoms. I want to find out what happened, what went wrong. Let's talk about, because I told you before, I get stopped and asked this question a lot, and people go, well, I had the blood work done, and I am within the range. Yeah, I'm normal. I was within the range, but I was going cuckoo and falling apart.
Well, this is important. Let's make a point. Just because your blood on your thyroid level falls within this broad range of normal, 95% of the people fall within the normal range. That's how they define what's normal. So you can't hardly fall out of the range. So the symptom, what you really need to do to make the diagnosis is you need a good clinical history to find out what the symptoms are, because they're classical features when people have low thyroid. The fatigue, inability to focus and think clearly, difficulty with weight, maybe cold sensitivity.
The immune system is impacted.
Yeah, and your immune system, commonly you get recurrent and chronic infections, which I think you had, didn't you? Sinus infections. Depressed moods, mood swings, irregular menstrual cycles, stomach disorders, hair falling out, puffy, pale, pasty, loss of romantic moods and inclinations. All these are common features of low thyroid. Yet you go to the doctor, particularly women, and they ask the doctor, say, I've got these problems. He looks at you like you got a screw loose in your head, does a blood test and says it's normal, and then he gives you an antidepressant. And that's the bane of society and the bane for women, because those antidepressants have some severe adverse effects on your mental function.
Yeah, and Johnny, one of the things that you were impressed with is that you didn't get an email when you went to the Hotze Health and Wellness Center. Someone really sat down and catered to you.
Exactly. It was Dr. Sheraton, and he sat there and he's like, I know what your blood work says, but you're showing the clinical signs of thyroidism, cortisol. Let's take a look at that and work on that. And he also put me on a diet. And the diet is not what I would call a true diet. It's a lifestyle change.
It's an eating program.
Right, right.
And I said, okay. And he's like, you know, just call back in a couple of weeks, let me know how you're doing. And within 3 weeks, I felt wonderful.
I look like at you, I know the diet worked, because that 35, 40 pounds that you gained in 1 month is gone.
And listen, Johnny is a very accomplished businesswoman in sales, and she's been very successful with a very large multinational corporation in doing her work. And so that had to have affected your work when you weren't feeling well. You weren't able to.
It did. It really did. Sales is highly competitive, as everyone well is aware.
You need that edge, and again, if you're falling apart, you can't do it.
You need to feel good. You need to make sound decisions. You need to be able to act quickly.
How do you feel now?
I feel wonderful. And just to kind of sum it all up, I was #1 in the nation out of 117 reps. And then I've maintained in the top 10 the last 3 years.
And could not have done that if you kept going downhill?
No, not at all.
All right, another life saved, Dr. Hotze. Dr. Hotze brought a copy of his new Hormones, Health, and Happiness audiobook for everyone in our studio audience. For those of you at home, you can order your copy from physicianspreference.com. Shipping is free. In that book, it explains how hormones work in our bodies from birth to old age. Dr. Hotze also hosts a radio show, Health and Wellness Solutions. Catch it Monday through Thursday from noon to 1 p.m. on 700 AM KSEV. And to make an appointment with the Hotze Health and Wellness Center, you can give them a call. The number is 281-698-8698, 281-698-8698, or log on to hotzehwc.com. If it walks like a duck, quacks like a duck, looks like a duck, it's a duck, so get that duck fixed. All right. October is the official month for breast cancer awareness, but April is for the man in your life.